In this video, we will discuss preseptal cellulitis. Preseptal cellulitis is an infection involving the subcutaneous tissues anterior to the orbital septum. It is more common than orbital cellulitis and is usually less severe, but it can occasionally lead to serious complications. Causative organisms. The most common organisms responsible are Staphylococcus aureus and Streptococcus pyogenes. Etiology. Infection usually follows skin trauma such as eyelid lacerations or insect bites, hematogenous spread from upper respiratory tract or middle ear infection, or spread from local ocular or periocular infection such as acute hordeolum, dacryocystitis, conjunctivitis, or sinusitis. Clinical features. Clinically, preseptal cellulitis presents with a swollen, often firm and tender red eyelid. The patients are frequently febrile. Key distinguishing features from orbital cellulitis. Unlike orbital cellulitis, preseptal cellulitis does not cause proptosis or chemosis. Visual acuity is normal, pupillary reactions are normal, and ocular motility is unimpaired in preseptal cellulitis. Diagnosis. The diagnosis of preseptal cellulitis is mainly clinical. Imaging with CT or MRI is not routinely required unless there is suspicion of orbital cellulitis, lid abscess, or poor response to therapy. When imaging is performed, CT typically demonstrates soft tissue opacification confined anterior to the orbital septum with no postseptal involvement. Treatment of mild to moderate disease. Oral antibiotics are the first-line treatment. Co-amoxiclav with 250 to 500 mg amoxicillin and 125 mg clavulanate is the most commonly used antibiotic and is given 2 to 3 times daily. An alternate dose is 875/125 mg twice daily. Dosing depends on the severity of the disease. Treatment of severe disease. Severe infections may require intravenous antibiotics and careful monitoring. In cases following trauma, the patient's tetanus status should always be checked. Complications. Although usually less serious, preseptal cellulitis can occasionally lead to serious complications such as lid abscess, orbital cellulitis, meningitis, or cavernous sinus thrombosis. For exams, remember that preseptal cellulitis is an anterior condition with preserved vision and eye movements. Absence of proptosis and chemosis is the key differentiating point from orbital cellulitis. Imaging is required only if red flags are present.